Hello, I'm Somi Arian. I'm the founder of the think tank for women in business and technology and the FemPeak platform, with the mission of raising women's socioeconomic status. Some of you may be aware that I'm super interested in wearable technologies, and I've invested in NuroKor Bioelectronics, which is a very exciting startup in this area. I discovered NuroKor when they came to me as a client first, through our marketing agency. At the time, I was preparing for a hernia surgery, and their device helped me avoid using heavy painkillers after my surgery. That made me think if there was an opportunity here for them to also develop wearable tech to help women through PMS. And I was really excited to find out that this was indeed something that they were working on, and so I decided to invest. Today's guest is Rowan, the CEO of NuroKor Bioelectronics, and we discussed how wearable tech in general and bioelectronics in particular could make a positive impact on the quality of women's lives. So here's my conversation with Rowan. So Rick, this is a conversation almost between two colleagues because we've been working together for quite a while now, since 2018. I remember when you came to me as a client and you wanted to know how we could work with you on your marketing, help you with the marketing of NuroKor. And I remember mentioning to you that I was going to have a hernia surgery, and you gave me the device, a NuroKor device, and you said it will help me with my pain management and recovery. I remember I didn't touch it. I put it aside until I had my hernia surgery, and then I remember calling you in pain. You're saying that I didn't want to be taking all those opioids and all the painkillers that I was given from the hospital, and you explained to me how to use the device. And I never looked back because I was using it basically within 36 hours of my surgery. I basically stopped taking painkillers, and I remember using it throughout the night, and I started using it, and when it stopped, my pain came back, and I woke up again. So I just loved the device. It really helped me so much. So can you try and help to our audience here what bioelectronic technology actually is and how it helps pain management and recovery?
Sure. So, I mean, there are variances. You will get varying replies to that question. But essentially the way that we view it and the way that we use the terminology is that it's the connection between biology and electronics. So it's the electrical or electronic impact that we can have on a physiological level within the body, so at a biological level. What we formulate and how those are applied then moves into what's called electroceuticals. So the application of that technology into therapeutics is electroceuticals.
That's a great explanation, Rick, but it's also a little bit technical. I remember that you told me the story of how our body is both electrical and chemical, and that just like the way that we can impact the body and influence pain pathways by chemicals, we can also do that through electrical stimulation. So can you go into that direction a little bit and explain about the way that the chemical and electrical side of the body work together?
You know, bioelectronics might be a new term. The use of bioelectronics or bioelectricals or electricity, biological electricity in the body is as old as ancient Egyptians, Roman times, when they were using electric fish for things like headaches and pain. But every process, essentially we are, as a living being, every process within our body and our body itself is electrical at both cellular level and then many other physiological level functions. So every time you move, every motion within your body, within the nervous system, is an electrical response that causes muscle contraction, that causes a nervous response, that is actually the living cells within your body. They are electrically charged. So if you want to think about things that people would know very, very well, you talk about a heart rate monitor within a hospital. You're talking about brain monitors, electrical responses. So, if you were to take a turn for a worse or you had to go into a hospital or an ICU, some of the very first things that they will monitor is your electrical responses, your bioelectrical responses. Mm-hmm. So the science of bioelectronics is, as mentioned, the influence that we can have at a therapeutic or at a health level for many areas using electricity, or bioelectricity directly to the source. As an example, when you are having a muscle contraction, your body is contracting that muscle through an electrical response. We can mechanically stimulate that muscle externally, and we can do it in some ways more precisely than the body can itself, because we only have a certain amount of control within the body. When we're doing something externally, we can have full control. Example, if you're lifting something very heavy, your body will always keep muscle fibers in reserve. So even if you're training extremely hard, you're not recruiting all muscle fibers. But I don't like to use the word artificially, but we can artificially stimulate 100% of those fibers using bioelectricity.
That's a great way to put it. And I really like how you gave this example of the heart rate monitor and the way that we use electrical signals to measure the way that our heart is performing. When was it that you realized that we could use electricity or electrical signals beyond just monitoring, and actually we could use it to influence the body? So what was your personal experience with it that drove you into that direction?
So I myself, similarly to you, it was an accidental discovery. So I was introduced to a product, quite a generic product that I used for a long-term back pain issue. And what I found was sometimes it helped and sometimes it didn't. And what this triggered me to do was to start to research and understand why was that? Why did it sometimes work and why did it sometimes not? I started loaning it to people who also had issues, and they were actually having a similar response to me. It worked today, but it didn't work, yesterday, and these types of things. And when I started to look at it, what it was that there was many studies that used a frequency for something or a certain parameter. There were other parameters that worked for the same thing, and so I started to think, well, what about if you were using both? What about if you were using a combination? What about if you knew which frequencies worked? And that's sort of where that journey started. But as for influencing in the body, I mean, again, this is not new. It's just that the research and our understanding of it has been somewhat limited to reasonably straightforward applications. Although I don't know that pacemakers are straightforward, but the mechanism is fairly straightforward. The pacemaker stimulates the heart muscle. It causes the heart to pump. Cochlear implants, as an example, you've got a hearing problem. So what a cochlear implant does is it's got a receiver microphone that then translates that into the electrical signals to the brain. You can hear. Mm-hmm. These types of scientific or medical applications are not new. And similarly with the nervous system, when you've got a response, we know that we can influence that response through peripheral nerve stimulation. We spoke a minute ago about influencing muscle. When you start to go deeper to things like cells and tissues, we're starting to understand that how we can influence those as well. From things like healing to inflammation, there's a lot of science going into actually being able to tap into the body's nervous system because it influences a lot of other physiological functions.
Can you talk a little bit about how bioelectronic technology can help with women's health and specific issues around female biology?
One of our spin-outs from NuroKor is our FemTech subsidiary. FemTech was created or formed with the specific purpose of addressing female health, specific health issues. One of the biggest areas and our first area of interest is period pain or dysmenorrhea, which is poorly treated. It's not very well known that it is such an issue. I mean, it affects, potential to affect 50% of the population of reproductive age. Impacts more the younger age group, between adolescents and mid-20s primarily, and it tends to become less of a problem as we sort of get into sort of later reproductive age. But for some women, it's a problem for many years. So through both the pain management side, as in the ability to manage pain, and the options for period pain are not great. They're things like hot water bottles, cup of tea, or over-the-counter pharmaceuticals or painkillers. But most of those, when you start to look at the efficacy or the effectiveness of those interventions, is very low. For some women, they literally cannot work or function for 2 days of a month, which seems rather incredible in 2021. So there's definitely the ability, or we've identified that there's the ability to manage pain through the nervous system. But the second part of that is the soft tissue response, which is caused by a type of inflammation, and then the neuromuscle responses. We know that we can also influence that through microcurrents, so reducing that inflammation and that soft tissue response. So it's very early days, but we're fairly confident of the mechanisms that we have identified and the research that we're doing, that we'll be able to bring quite a disruptive solution to market within the next 12 to 18 months.
This is all very exciting and promising. I really hope that we can make such a huge level of impact as you described. For me, PMS is so much bigger than just pain, and I really hope that we can create technology that can go beyond just managing pain and work with the body on a more holistic level.
I mean, yes, and nothing happens in isolation. So even if you just looked at the fact that dealing with pain and that physiological response is taxing on the central nervous system, so the reduction of that leaves the central nervous system to have its reserves back. There's many functions, including the psychological one. When you've got a pain response, you've got changes in hormone levels, a whole range of things. Nothing happens on its own. So certainly, the positive outcome from that as a cascade event. We haven't measured it as yet, but it seems fairly obvious that it will impact in other ways.
Another big issue when it comes to women's health is that we know so little about female biology. So there's quite a lot of data gap there. Do you see an opportunity for bioelectronic technology to be able to close that data gap and help us gather data more effectively to better understand female biology?
It's an interesting point you make, and without giving too much away, we have recently filed some patents in this area. You're absolutely correct. So for when we're looking at any type of intervention, so we mentioned before about painkillers as an example. That essentially what you're doing is you're using a hammer for a solution that there isn't necessarily a nail for. Okay. So it's a systemic response. So you're doing something systemically, and you're blanket covering something. And most of the other interventions out there are very similar. They're not personalized for the individual. So similarly with any type of pain, what one person needs versus another person will be different. So based off of data, we will be able to personalize that response to the individual. But the second part of that is using sensor technology to be able to measure a biological response and then an active intervention accordingly. As well as start to look at a large cohort of data for for both, not just females, but for how that might impact and what positive impact we can have in that response.
I have to say it's very exciting, the promise of being able to reach that level of personalization, go that minute into actually targeting the specific areas that need attention rather than inundating the entire body with chemicals. I was recently talking to another one of our panelists who's an investor in FemTech area, and she gave very good insight. She mentioned something about how female-led companies or FemTech companies are getting to a point that they're raising the initial investment and getting to through angel investors and getting to the next levels. And then by the time they get to their Series A and Series B, and when they need to raise a lot more money through VCs, it gets to a point that because there are not many female VCs, so you're sitting in a room full of male investors at that higher level, and you're talking about uteruses and wombs and female health issues, and that to some degree makes it harder and makes the conversation more difficult. So for me, working with you, it's very interesting because you're a man working on a female health issue, and it's very interesting to see how do you go about pitching this, and what's your experience been in that regard?
It's an interesting point, and without making it too simplistic, I think that there is some key, how would you say, some key marketing or sales theories that need to be applied here. So yes, you're right, I haven't personally experienced period pain, and if I was pitching it to another male CEO or investor, I probably wouldn't talk about it as a female pain issue. I'd talk about it as a social issue, as one that affects 50% of the population, and that has other peripheral impacts. So whether or not it is a wife, partner, family member that it may affect, that's not that's sort of one position, but the other is that it's a human issue. It's a human condition issue. So I think that yes, it can be challenging, but it's about trying to position, like selling anything, it's about trying to position what is the need of those investors, or what is the interest of those investors, and positioning it accordingly. Similarly, our team is made up of diverse range of male, female, ethnic backgrounds, etc. But they all believe in what FemTech, or what our FemTech division can achieve for humans, not just women, because it doesn't just affect women. It might affect them in isolation, but it affects humans in a number of ways. And if you're talking about economics, it might just be workforce. If you're talking about social impact, it might be family unit, or it might be partnerships. It is absolutely a range of things.
It's a social and a human reality, and I feel like there's a lot of quiet suffering going on there as women deal with these pains and don't really openly talk about it. I sometimes get criticism from women sending me messages saying, why are you even talking about period pain and menopause and all these different women's health issues? Because by talking about it, you're actually playing into the hands of people who want to use that as an excuse to keep women behind, and or keep women on a lower wage, or not give them work opportunities. So they see it from that perspective. But the way I look at it is that I think it's like I said, it's a social and human reality, and I don't think it's okay for half of the population, or maybe 70 to 80% of that population, to be suffering quietly and dealing with these pains. So to me, I think if there's a pain, there's an opportunity to relieve it and better the quality of human life. So I'd be interested to hear your thoughts on that.
I don't know what the right answer there is. I think that for someone to have that type of attitude without upsetting some of your audience, I actually think it's a very small-minded one, and one that is quite abstract in the scheme of things. Because I think that where any health challenge lays, whether it's female, whether it's male, whether it's workforce, or whether it is, if there's an opportunity for us to provide a good solution for that, particularly one that fits into lifestyle, that basically improves quality of life, I think that should be addressed and pursued with the same vigor as any other area.
Yeah, absolutely. I totally agree. So what other challenges or conditions can bioelectronics help us with within FemTech and women's health?
Women's health specifically, there are many. I mentioned that period pain is probably our first area. Other areas that are closely related are things like endometriosis. There is, as an example, we've looked at studies that there's a correlation between infertility and ATP production, which is sort of a cell energy that the body produces. We know that we can influence ATP with microcurrent as an example. So, that's a completely different area, fertility. Then we've got things such as pelvic floor, such as, menopause symptoms. Female health specific. We could keep going. I could pick different body parts if you like. But similarly, some of them are not female specific, but they are weighted towards being more of a female challenge than male. There's a difference between sort of male and female conditions with certain ailments such as arthritis and other things. And menopause creates a whole range of hormonal issues that create other physiological issues, as an example. And bioelectrics or electroceuticals have the potential to be able to make positive impact in a range of areas.
This is all very exciting, Rick, and I really hope that by the time I speak to you next time, we will have made so much more progress, and we will have the opportunity to relieve more suffering and pain from the world and for women. And I want you to know that I'm right behind you, and I can't wait to help you make this a success.
Thank you. We're appreciative of it. But look, we are going very, very fast. we have done in the main company and certainly in the FemTech area as well. And, I'm proud that of the people that we've attracted and the people that are involved, including yourself, because, I think there's some amazing things that we can do and have an impact on global health.
Thank you, Rick. It's been great talking to you. Thanks for being here.
Absolutely.
Thank you.
Thanks.
I hope you enjoyed this conversation with Rick Rowan. Stay tuned, as there are so many exciting movements happening in NuroKor. Remember to subscribe to this podcast on Apple, Spotify, or any other one of your favorite podcast channels. And don't forget to give it a 5-star review. You can also find the full video of these conversations on my YouTube channel. Oh, and connect with me on LinkedIn, Twitter, Instagram, or Clubhouse at Somi Arian. Finally, if you're not yet a member of FemPeak, head over to fempeak.ai, register, and join a community that actively supports women.